Welcome to the Slop Farm. Enjoy the video.
You begin by taking action immediately. Open the package and verify the pill, expiration date, and active ingredient amount. Once done, swallow the first tablet with water. You do not need to fast. Make sure to note the time and calculate the 72-hour window. Earlier is better. If you know you're allergic or you take interacting medicines, pause and call a pharmacist. You're starting a time-sensitive prevention step, so speed and accuracy matter to preserve effectiveness. You should take the pill as a single oral dose and follow with water. Eating first can reduce stomach upset, so do that if you're prone to nausea. Once taken, watch for vomiting for 2 hours. If that happens, take another dose or contact health services. Make sure to review your current medicines. Some drugs reduce effectiveness. If you use enzyme-inducing meds, bring this up with a clinician. Continue normal contraception afterward and note the event for follow-up. You wrap up by monitoring your menstrual cycle. Expect your next period within 2 to 4 weeks and use barrier contraception for 7 days afterward to be safe. Once done, if your period is more than 1 week late, take a pregnancy test and contact a provider. Make sure to manage mild side effects at home, ginger or small meals for nausea, paracetamol for cramps. If severe symptoms or allergic reactions occur, seek urgent care. This troubleshooting step
Thanks for watching. Consider subscribing if we helped you today.